Welcome to Diabetes Awareness Program serial videos. I am Dr. N.S. Ramesh, Senior Consultant Diabetologist from Diaplus Diabetes Specialty Center, Basangudi, Bangalore. Let us move to episode number 11. Here, let us discuss what are the complications of diabetes. Diabetes complicating a patient means it is a sort of defeat of the patient by diabetes. In Bhagavad Gita, Lord Krishna clearly told to get victory or success, truth, honesty, obedience, respect, discipline, hard work, etc. These are utterly necessary. So similarly, to win over diabetes or to not to get the complications of diabetes, this slogan holds good. One who observes control over his diet, takes regular exercise, has time to relax, does the right toil in the discharge of his duties, observes proper hours of sleep and awakening, and is balanced in his action and reaction, emotions and reason, duties and rewards, conquers diseases. So this slogan holds good. So discipline, hard work, diligent and efficient, intelligent care. If it is taken, exercised in the management of diabetes, definitely we can prevent complications. The complications of diabetes are divided into two varieties, that is long-term complications which occur over years, and short-term complications, they are sudden in onset. Coming to the long-term complications of diabetes, they are divided into two varieties, that is vascular and non-vascular complications. The vascular complications are related to the damage of the varieties of blood vessels in the body. The non-vascular complications are not related to the damage of these are the damages not due to the damage of the blood vessels. Short-term complications are divided into two varieties, hypoglycemia, that is sudden low sugars, and DKA, diabetic ketoacidosis, that is due to high sugars, usually along with infections. The vascular complications are of two types, macrovascular complications and microvascular complications. The macrovascular complications are the damages related to the damage of the major blood vessels, and the microvascular complications are the damages related to the damage of the small vessels, blood vessels in the body. The macrovascular complications are again divided into three varieties, that is damages related to the major blood vessels, that is three types. Cardiovascular complications, that is the damage of the blood vessels supplying the heart and also the heart also. Number two, cerebrovascular complications. These are the complications related to the damage of the blood vessels supplying the brain. The third variety is peripheral vascular complication, that is the damage of the blood vessels which supply the extremities, that is the upper limbs and the lower limbs. Coming to the microvascular complication, that is the small blood vessels, there are again three varieties, retinopathy, nephropathy and neuropathy. Retinopathy means the damage of the retina of the eyeball. Nephropathy means damage of the kidney, that is we call here it is diabetic kidney disease. And the neuropathy, that is damage of the nerves, nerves in the different areas of the human body. The non-vascular complications, they are really many and many. Any organ or any system in the body can get involved, that is non-vascular complication. There are many. Number one, skeletal complication, that is skeletal complications arising in the bones and joints. Number two, complications during pregnancy, that is complications during pregnancy in the different trimesters and also during delivery. Fetal complications, again the complications arising to the fetus in 3 trimesters and also during delivery. Infections, varieties of infections, that is bacterial infections, viral infections, fungus infections, they are very common in diabetes. Dental complications, that is the teeth and the gums, etc., the oral cavity, etc. Depression is very common in diabetes patients. Number 7, cancers, that is cancer, the incidence of cancer is very common in diabetes, and many of the cancer patients will have diabetes also. Thank you. These are the complications. This is the classification of the diabetes.